A transformative investment is putting the spotlight on Indigenous health and healing practices. St. Michael's Hospital in Toronto is announcing today it has received an $11 million donation, and the money is going towards building an Indigenous wellness center. It's going to offer Indigenous-led, culturally sensitive care. For a look at what that means, and with more this morning, we're joined by Roberta Pike, Director of Indigenous Health and Reconciliation and Partnerships at Unity Health Toronto. Good morning and welcome. Congratulations. It's a big day.
Thank you. It is.
This funding is going to go towards, in part, new Indigenous wellness centers, some land-based healing practices, and more positions for Indigenous wellness workers. Tell us about each of these programs and how they will service the clients.
So Unity Health itself made a commitment for a core team of Indigenous wellness workers about a year and a half ago. This donation that we're receiving today is going to be foundational to expanding the frontline services we're providing to Indigenous people throughout the hospital at both St. Mike's and at Providence. In addition to that, we are going to be able to use our wellness space to be able to have a welcoming center for Indigenous people to come to the hospital and meet up with our wellness team members. It's also going to be a beautiful ceremonial space for families to conduct ceremony in when the patient room might not be large enough. And it also will double as an educational space, not only for patients, but also for our healthcare professionals that work at the hospital.
It's fascinating to me that it's in the hospital because, you know, we've seen horrific stories and headlines coming out about the treatment or care of Indigenous people in hospitals or lack of treatment and care in these hospitals. It seems like a really significant choice that you choose to put it there, so to turn it, I guess, into a more welcoming space.
Absolutely. It will be a hub of everything at the hospital, and it actually will be such a beautiful and welcoming space for people. Traditionally, downtown, there is a huge number of Indigenous people that access our services. So knowing that there is a place to touch down and to go to that is safe and welcoming is fundamental.
7 of the calls to action in the Truth and Reconciliation Commission's report had to do, a lot of people don't know this, but they had to do specifically with healthcare, and that's inequities that exist right now. So why are Indigenous-led healthcare options important for reconciliation?
I think that, you know, as Indigenous people, we know that the strength in the actual change that will happen needs to come from our communities. Not only the solutions to things, but also the strength of culture and traditions. So hospital and this donation will further the ability for us to be able to get back to those things. Those calls to action talk about reconciliation. They talk about increased resources that are relevant to knowledge keepers in traditional ways, and we're implementing all of those things at our hospital in each of those from call to action 18 to 24.
How present are the gaps right now in the current healthcare system? We know the healthcare system is broken, so we say gaps, but really in some cases they are chasm. But when we're dealing with Indigenous people in Canada, what does that look like across the country?
Oh boy, there is many challenges. So for Indigenous people, there is a whole history of mistrust. It goes way back in terms of our history of Indigenous relations in Canada. And so healthcare system itself is not traditionally been a safe place to access service. So this will be fundamental in terms of being able to, you know, change relationships going forward in building more trust. Yeah. And having more sense of community and belonging at the hospital.
This is a great first step, and as you say, it's been transformative, it will be foundational, but what issues do you still think need to be addressed?
There is, I think, a bigger call to increase funding for hospital systems. There have been a few hospitals in Ontario that are Indigenous that have had funding, but for the most part, the lion's share of hospitals, everybody receives, you know, funding that is meant for all Ontarians. And so it would be wonderful if there wasn't so much of this jurisdictional kind of dispute, especially around, you know, who is paying for services for Indigenous people within hospitals. It is both a provincial and a federal responsibility.
Interesting to see whose lives it changes and how they change. Roberta Pike, thanks for coming in today.
Thank you.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.